Hey everyone, welcome to the Economic Outlook for 2023, the Potential Impact on Healthcare Centers webinar. My name is Denise Maraita. I'm part of the CCD Health marketing team, and I will be the moderator for today's webinar. We appreciate you joining us today, and we'll start with our experts shortly. For housekeeping, if you're having any technical issues, please let us know in the Q&A chat. The most common issues are solved by restarting your Zoom application or refreshing your window if you are in a web-based service. But if you have any questions, please feel free to drop them on the Q&A. I want to quickly introduce our speaker for today, Edison Sepúlveda. Edison is the Vice President of Product Innovation at CCD Health. Edison has a pretty extensive background in economics. He is a former Ernst & Young consultant and a chartered financial analyst. Today, he will cover some of the macroeconomic trends and Medicare changes scheduled for this year and how they will impact the healthcare sector. Edison, welcome. And if you want to tell us a little bit more about yourself and what you do for CCD.
Thank you, Dennis, and welcome everyone in the audience today. Basically, I work with CCD, been with CCD for 7 years now, working mostly with IT and now driving the innovation and product development for the company. Looking forward to sharing some interesting insights with our audience.
Sure. Well, I'm excited to have you here, Edison, and we'll start with our topic now. So our quick agenda for today will go over the US macroeconomic trends, the change in technology needs, and some strategies to mitigate risks and ensure successful operation at healthcare practices and radiology centers this year, as well as a Q&A section at the end of the webinar. And speaking of Q&A, please, again, utilize the Q&A chat box. Edison will be answering any questions at the end of the session, but feel free to ask any questions as they come to your mind and submit them at any time. Also, we wanted to let you know that we will be recording this webinar, and you will receive an email with the link of the recording 48 hours after we conclude the session. Okay, Edison, I'll hand it over to you again. We can start.
Thank you, Dennis. And basically, we want to start with a bit of the macro picture. Just speaking about the GDP trends that we're seeing, because healthcare, and most of you know, is the most significant item in all of the United States GDP. And just for those in the audience that don't know what GDP is, it's basically a measure of all the aggregate economic movement within a country or an economy. And what this is saying is that every investment, every transaction, and every import and export is basically registered in this measure. Right now, the healthcare industry or healthcare verticals in the US represents about 17% of the total GDP. That's a massive number, considering that just about 30 years ago, it was close to 6%. And this is by far the most in any OECD country, any advanced economy. And what is driving that? There are some both positive and negative drivers for that number. First, the positive, the US healthcare industry invests a lot in technology. We've seen a lot of these health tech startups and health tech companies that are driving a lot of the innovation trend in healthcare across the globe. We also see, for example, that the US has one of the highest penetration in all of the world in the number of MRI machines per capita, and this is constantly renewed to offer a better service. And we work constantly with radiology groups, and we know for a fact that they have some of the most advanced technology in the world. But there are some negative drivers as well. And we're going to be speaking about how we could create a competitive advantage based on those negative drivers. The first one and the most significant, in our opinion, are the administrative costs. The US, for example, has 6 times as much administrative costs in healthcare as a country like Canada, for example, which is another very close comparable. And this is mostly driven by some of the complexities in the systems. As you know, more than 900 payers in the United States, and the lack of a standardization. And this administrative cost, out of the 3.5 trillions estimated for the healthcare industry, this represents close to $800 billion. As we all know, there are a lot of processes related to billing, coding, prior authorization, scheduling that are significantly increasing the amount of manual labor and work that you need to perform to be able to become a provider or do your job as a provider in the States. Now, talking about the trends, because we're looking into the future, right? This is not expected to get better by any measure due to the regulation that we see coming, as well as some of the demographic trends. And one of these demographic trends is the aging population, because as we all know, the last batch of the baby boomer cohort is now entering that elderly adulthood. And that means that they will require, as they advance in age, they will require more of that healthcare service, of those healthcare services. And what that entails is that it's going to become more costly to serve all these people that are having a higher utilization inside the healthcare industry. And we see the trends is expected to grow at a significant faster pace that has been growing over the last couple of years, mainly driven, as I mentioned, by those retirees that will be using those healthcare services. And then the expansion of the Medicare program for all of these segments of the population. Moving on to the next slide. We can see another one of the significant trends that is affecting these healthcare costs in the United States, because we see both upward pressures, as we just discussed, the aging population, all the administrative burdens, the regulations, but then there is also downward pressure on the cost of providing healthcare. And this is mostly driven by the CMS, which, as you know, has a lot of bargaining power with providers, given that they are the largest payer by far in the States. And what we see here is that, and you've seen in the news, especially recently, with all the discussions around the debt ceilings and whatnot within the government, there's always a push and striving for a balanced budget. And what that means is that part of one of the most significant items for the government is actually healthcare. So they're pushing a lot of regulations, a lot of acts to try to balance the budget, and that implies that there will be some cost cutting. And we won't expand too much into what are all of these, but basically what we see is that the drive is for downward pressure on the healthcare services cost for the CMS for the government. The most significant that we can mention is the what is the pay-go sequester. This was actually expected to go into term in 2022, but it was moved thanks to some lobbying efforts from the healthcare industry. It was able to be moved. This is a work in progress still, even though it's expected to be 4% and 2%, depending on what you're looking at. It's up for change, and it's still being discussed as we speak. But it's something to keep in mind, because this could significantly affect those reimbursement rates for most payers. And this is what we're looking forward, especially now that the budget is so unbalanced that it requires some change. Moving forward. So there are two conflicting trends here, because what we see on one hand is that we need to balance the budget. The country needs to balance the budget. However, there's also that push from people who are being enrolled every day in Medicare. And what that means is that naturally it will be a rise in demand, and by consequence, rising cost of providing services to this Medicare Advantage program. And then there's always that need to revise the coverage and the type of plans that CMS offer. We are mostly talking about Medicare, but it's also always a topic for discussion, the Medicaid, which is actually one of the largest as well. And then the technology piece, which, as we know, typically what technology does in healthcare, it's that it creates a significant spike in the cost of providing a healthcare. And as we go even more specific, for example, in the type of treatments, and for example, I can mention that these genetic treatment that are being developed by the big pharma companies that can treat a very specific segment of the population for very specific diseases, due to the supply and demand effect, are gonna become a bigger burden on the cost of healthcare, because as they target a significantly lower number of people, then that means that the cost of giving those treatment to those people will increase as well. So that's one thing that we need to keep in mind, because that's one of the most significant drivers. And then we always need to discuss where we mostly work with, which is imaging. And imaging is typically considered by most payers a low value or a lower value than other treatments due to the cost. However, there's a trend from most referring physicians to utilize more of these imaging services, and that's because that's one way with relatively low invasiveness, that you can check a patient and understand what could be the ailment of that patient. So there's that trend as well. But on one hand, we have doctors pushing for more imaging. On the other hand, we have the payers trying to understand why we need more imaging, especially because of the cost, but also because of the number of false positive that we all understand happen a lot within the imaging space. And for 2023 specifically, what can we expect? Because we discussed already a lot of regulatory changes, a lot of regulations that are going to affect mainly the reimbursement rates. And there are some good lobbying efforts being worked on right now that could affect the path, be it the date or the impact of those regulations. However, there are others that we need to take into account. Over the last couple of years, being at cost push or just because of issues with the value chain, the supply chain, we've seen a lot of inflationary pressure. And even though healthcare has been, for the most part, able to transfer some of those costs to the patients and the payers, the reality is that most providers have seen some of the margins shrink due to these inflationary pressures, because that's affected wages, as well as some of the things you need to purchase, those medical devices and items that you need to purchase to be able to operate a practice or any other type of provider. And what that entails is that your margin, as long as these inflationary pressures continue, the likelihood is that the margins will continue to shrink. And we also see that this inflationary pressure usually lead to those increasing rates. And healthcare is very dependent on that, especially the imaging sector, given the large capex disbursement or expense that they need to typically do to be able to set up a provider, a facility to provide imaging services. Then the staffing shortages, and we'll know this trend. The utilization for healthcare in the United States is higher than basically any other OECD country, any other advanced economy. And what that means is that Americans are going more to the doctors, so the demand is higher. We are not growing the number of doctors and nurses as fast as we're growing the demand for those services. And what that entails is that we are facing a staffing shortages across the board. And this doesn't only apply to medical personnel. We've seen also this for scheduling, prior auth, coding, and that's why that trend for both outsourcing and the technology component is so strong right now, because most providers are looking for both that way to stop the shrinking margins, as well as minimize the effect of those staffing shortages. And then the affordability pressure which impacts on the collections for most providers, and that account is growing for most of the providers who serve patients who are not able to afford whatever they are invoiced, and then need to either make some type of agreement with the provider or just flat out not pay. We've seen those collection numbers go up every year for most of the partners that work with CCD and Paciente. So moving forward, yeah, there are some things that if you're thinking, okay, this is basically a macroeconomic view, a macro view of how the healthcare industry is moving, but even small practices can start doing some things to alleviate some of these pressures and some of these both negative drivers and negative trends that are affecting healthcare. One of them is, we always mention, try to join up with those clusters or associations. We know a couple like RVMA, RSNA in the radiology industry that are doing some work in terms of lobbying, and the more number of associates, the higher number of partners, the more bargaining power with payers, as well as the CMS, those associations will have. So we typically encourage for the regulation piece that you do it through one of these associations, one of these clusters. But then to address the staffing shortages, we always say that there's an opportunity for you to create that competitive advantage versus other providers by exploring outsourcing. We mentioned that out of those 3.5 trillion in healthcare, 800 billion is for administrative tasks. So those tasks are very expensive right now, and you can go to a cheaper, more affordable delivery location, so that you can look into how you can manage those costs and protect your margin, make your business more defensible. Then there's a significant trend for technology and automation. I believe we're at a point right now where we had a couple of breakthroughs. We're actually working with some partners to deliver a lot of these technology and automation tools that can significantly decrease, and we've seen anywhere from 20 to 50% in a specific task or functions within a provider, a practice. So that's something to explore. And if you want to know more in detail, feel free to reach out and we can have a discussion around what's your cost base, your cost structure, and how we can may be able to lower it. And then the patient engagement. I believe this is, for most companies, most sectors, this is the biggest competitive advantage that you can develop. Even if you can charge, if you're charging more, if you have created a really good patient engagement and patient experience, I believe you could create loyalty, because switching costs in healthcare, people who transfer from one provider to the other are relatively high, just because you want to go to the same doctor, you want to go to the same practice, you want to go to the same radiology group, just because you know what you're getting. So typically those switching costs will be high. However, one of the things that you need to do to keep it high is always be aware that the patient engagement and the patient experience has to be top of mind. So those are kind of like the high level suggestions that we can offer in this short period of time that we have. However, we do want to take a couple minutes to take some of the questions as well.
Yeah, thank you, Edison. Definitely a lot of game changers are happening this year, right? So let's have a quick look at questions from the audience. I think we have some minutes still. So we have a first question. What are the strategies that you recommend for balancing Medicare and the private healthcare insurance management within a practice or a radiology center in this case?
Yep. Typically, you don't want to do discrimination of your patients. And by discrimination, I mean in the economic sense, like price discrimination. So you don't want to turn down patients, right? Because that would reflect bad on a provider, and as well, it would be a missed revenue opportunity. So as I mentioned, what I typically suggest is that the stronger any vertical is, the better, to be able to increase that bargaining power that they may have with some of the payers. And you might see this as, for those who are familiar with economic terms, the prisoner's dilemma, where you're also helping your competition. But in reality, if the tide grows, it will lift all boats. So we typically recommend here is that you can support these lobbying efforts, but as a group instead of as an individual provider, just because of the effect on the bargaining power that you may have.
Great. Well, here is one question that is for radiology practices. It says the customer journey at radiology centers is shorter than other healthcare specialties. I agree. How can radiology centers enhance that experience to bring more referrals and keep their current patients engaged?
Yep, that's a good question, and I think this would apply to other healthcare specialties as well. But basically, is having the process end to end well mapped, and understanding that what affects the customer satisfaction. And you can use a data-driven approach to understand what are some of these drivers. Could it be the turnaround time for these patients? Could it be the engagement that they get from the people they are speaking to, be it schedulers, be it front office staff, be it the technicians? Could it be the quality of the service that they are getting? Or could it be just the simply I'm going to the practice, the provider, the radiology group, where my doctor, my referring physician will send me? Typically, what we've seen has the most impact is trying to shorten those turnaround times, be it in terms of how fast they can get their appointment done, how fast they can actually get their exam done, how fast they can complete everything related to their a payer. If prior authorization, for example, is required, how quickly can you get that done? And so that it doesn't affect or delay care for that patient. And as we mentioned, try to leverage technology as much as possible. Having manual labor do all the work, especially when there is variability in the demand, will typically require to either overstaff or just provide a lower service level. So you can fix that by leveraging technology to maybe taking on those lesser functions or tasks that could be completed by either a machine or any type of software.
All right. And let's go for the last one. Over the years, we've been seeing lots of papers and studies saying that healthcare in general is recession-proof sector, that no matter what happens with the economy, people will always need a doctor, right? So what do you think? Is recession, it's healthcare a recession-proof sector or is not? What do you think?
Yeah. Yeah, there's a lot of opinions in terms of that and what we could call recession proof, but definitely not. We've seen that even though healthcare is less affected than discretionary spending in terms of the economic impact, we've seen a slowdown, significant slowdowns in healthcare expenditures when the economy enters into a recession. And there's been some discussions about what a recession is and what a recession is not recently in the media. But what we've seen, if we see a trend of how healthcare spends growth across time, and during those recessionary periods, we see that healthcare has been indeed able to grow for the most part through those recessionary periods, except for those like in 2008, 2009, and back in 1987 as well. But besides that, for the most part, healthcare has been able to grow in terms of the representations in the GDP. However, what we've seen in those periods, those recessionary periods, is probably a slowdown. So the healthcare has not been growing as fast, and that clearly creates an economic impact. So long story short, it's not a recessionary proof. It is affected less than discretionary spending, but it is affected indeed.
All right. Well, Edison, thank you. And in summary, I think that we can say that overall, the economic outlook is not encouraging at all. However, healthcare providers have options as we look toward the near future. What I understood is, for example, that staffing shortages can be addressed proactively by partnering with providers and outsourcers. Like all that is not a core task at your practice can be addressed by doing so. Also, a strong workforce management and forecasting analytics can help predict attrition and enhance the backfill approaches. And finally, technology is the next must-have strategy, right? For example, including the automated prior authorizations and conversational AI to lead the patient interactions, that it's already a game changer, right? So, well, as a reminder, we'll be sending out the email with the recording of this webinar within 48 hours. Make sure to look for future webinars with CCD Health and more resources to help you out with your practice management at ccdcare.com. ccdcare.com, and do not hesitate to contact our sales team if you want to explore more information on how we can partner with you and provide outsourcing and consulting services to your practice and improve your back office management with intelligent analytics, appointment scheduling, and top-notch technology. So thank you to everyone that participated in this session. This concludes our webinar, and you have a great day.
Thank you, everyone.
Thank you.